Okay, good evening, everyone, and welcome to our public meeting of planning. Is there any disclosure of conflict of interest among our members? Seeing none, I have a motion to accept the agenda. Motion's moved by Councillor Noble, seconded by Councillor Madden, that the Council of the Township of North Glengarry accepts the public meeting agenda of Monday, January 11th, 2021. All those in favor? Motion is carried. Okay. And ratify the minutes of Monday, December 14th, 2020. I have a motion moved by Councillor Manley. I do not see Councillor Winston here.
She's just there, yeah. Or she's trying to get in.
Okay, I'll move, seconded by Councillor Michael Madden. That the Council of the Township of North Glengarry accepts the minutes of the public meeting of planning of Monday, December 14th, 2020. Any discussion on the minutes? Seeing none, all those in favor? Motion is carried. Thank you. Okay, so moving on to zoning amendment Z01 2021. Kasia.
Thank you, Mr. Mayor. I will be sharing my screen.
And welcome to our public meeting of planning.
Okay, everyone should be able to see the screen. You can nod if you do. Thank you. So zoning amendment 01 2021. The owner for the subject land is Donnelly Baxter. The location is at 19905 County Road 24 in Dunvegan. The lands are zoned and designated agriculture, general agriculture. So these are the lands in front of you. This is a consent severance in the agricultural lands. So the severed lands are about 3 acres and the remainder is about 197 acres. In front of you, you have the screenshot. So the entirety of the lands, air view photo. And then there's a zoned portion for the 3 acres that are proposed to be severed. And then a further zone with the single detached dwelling and a shed towards the back. And then the surrounding green space and the laneway that leads up to the dwelling. So the purpose of the zoning amendment is to prohibit residential development on the retained lands by rezoning the retained lands from general ag to a special exception AGPR and to prohibit agricultural uses and to acknowledge the minimum required lot frontage deficiency on the severed lands by rezoning the severed lands from general ag to a special exception AG 192 as per the conditions of consent application B9720. So as I mentioned, the entirety of the lands is an area about 200 acres and 3 acres are to be severed. So the applicant received a conditional consent from the counties on November 26th last year. So this is pretty standard. The PPS and the SDG county's official plan permit surplus dwelling lot severances as long as they are kept to a minimum area of 3 acres, more or less. So the recommendation of the planning department is that the zoning amendment 01 2021 be forwarded to the Council of Township of North Glengarry for further consideration approval. And just a note, I did not receive any comments for this zoning amendment. Thank you.
Thank you, Kasia. And I know that Mr. Donnelly Baxter is on. Just not sure, sir, did you want to add anything to it during the public portion of this meeting? Okay, seeing not. Are there any questions from members of the committee? We'll be reviewing this again in the public meeting. If you have questions then as well, but if there are any right now. Okay, seeing none, we'll move on to zoning amendment Z02 2021. Kasia.
Thank you, Mr. Mayor. I will go back to my presentation slides. Okay, so Z02 2021. The owner of the lands is Luc Prudhomme. The property is located at 64 Lahue Street East in Alexandria. The land is designated residential district in the official plan and is zoned general commercial in our zoning bylaw. So the location is at the intersection of Lohiel Street East and Bishop Street South. As you see, the subject lands, it's an existing building. So the purpose of the zoning amendment is to convert the use. So this is just a Google Street shot of the property, viewing it from Lohiel Street East. And this is as it can be viewed from Bishop Street. The purpose of the application is to rezone the lands from general commercial to residential fourth density, R47, to permit a 4-unit apartment dwelling with 3 parking spaces, which is a reduction from the required 6 parking spaces. And as I mentioned, it's located at the intersection of Lohiel Street East and Bishop Street South. The subject land is approximately 0.18 acres in area. The current zoning is general commercial, and it currently contains a family fun center. So it used to be an arcade, but since there wasn't so much demand for this type of use, the owner is proposing to rezone it for an apartment dwelling with 4 units. So currently the second floor does contain a residential unit. It will be converted into 2 units. So 2 units upstairs and 2 units downstairs. So just a little bit about the surrounding uses. So the surrounding uses include residential uses to the north, west, and south, and there's a commercial use to the east with the following zoning. So R1 to the south and north, and R4 to the west, and general commercial 9 to the east, which is a computer service and sale shop. So some more details for you. The proposal is to convert the existing commercial use into 4 apartment units. 6 parking spaces are required, but the proposal only includes 3 parking spaces. That's why it's R47, a special exception to the R residential 4th density zone. However, additional parking is available during the day hours on Bishop Street South and Lohiel Street East. And no site plan control will be required for the proposed conversion, as it only includes restructuring of the interior of the building. So building permits for the renovation and change of use will be sufficient for this type of development. So this is just a simple site plan for you. So the building is existing. There will be no changes to the outside elevations or facades. Majority of the changes will be interior renovation. And you can see 4 parking spaces. 2 of them are in tandem. That's why the owner decided or proposed to us that it's counted as 1 parking space instead, even though it is actually 4 parking spaces. So just an overview of the Provincial Policy Statement 2020. The proposed zoning amendment is consistent with the PPS 2020. So the proposed zoning amendment promotes the efficient use of land and is appropriate for and makes efficient use of the existing infrastructure, such as municipal water and wastewater services. So that is currently existing and will be made use of. And the conversion of the family fun center arcade to an apartment will redevelop to a use that is high in demand in Northland area, as everybody knows, residential use is high in demand. And the location is appropriate since it's located along an arterial road and is connected to full municipal services, as well as including stormwater. So the proposed amendment for a dwelling conversion will provide a use which has been underutilized since its conversion to a commercial use in 2018. So there was actually another zoning amendment in 2018 to convert it from institutional use to the gaming arcade, but since there wasn't enough demand, this is why we're here again, to rezone it to a residential use, which is definitely in high demand. So similarly, for the SDG County's official plan 2018, the lands are designated residential district, and this designation permits a full range of density of uses from low, medium to high density housing. So therefore, the proposed amendment is fully in conformity with the SDG official plan. And given that the surrounding uses are largely residential, it is highly compatible and desirable with the surrounding area. Therefore, it's the recommendation of the planning department to approve the amendment as submitted. Thank you.
Thank you, Kasia. And I know that we have Mr. Jacques LeBlanc and his wife on. Mr. LeBlanc, did you wish to comment on this this application?
I just wanted to make sure it did not affect, because there are parts of lots 11, 12, and 13 that it does not change anything on my side.
Right. And Kasia, can
It will not change the use of the adjacent lands. I clarified that to Mr. Yes.
Okay,
okay,
yes.
that's good. Great, thank you. Any further questions or comments from members of the committee? Deputy Mayor Williams.
Thank you, Mr. Mayor. I have a couple questions, but I'll just ask one for now. With regards to the zoning amendment, Kasia, the previous zoning you said was institutional.
Yes.
What was in there previously to the arcade?
It was some kind of worship use. It wasn't a church, but that's what it was.
Oh, and so had it been institutional for years and years?
Used to be a grocery store.
Used to be a grocery store.
Grocery store.
Okay, I don't necessarily object to the change of zoning and the change of use. I'm just uneasy, always uneasy about converting main floor commercial to residential, especially on our busy streets. I know this isn't Main Street, but it's still quite it's one of the main roads in Alexandria. Any economic development officer will tell you that allowing residential in your commercial area on main floors eats away at your availability for commercial space for either purchase or rent, and affects the ability to be able to draw businesses into your community. So it's I guess it's a comment, because looking at the outside of the building, it looks to me more residential than commercial anyway. But I guess just a note that generally speaking, I would not be in favor of such an amendment, but
Okay.
I think it's appropriate.
Thank you. Councillor Madden, you had a comment?
Thank you, Mr. Mayor. Just a quick question about the parking spots. Do we have any concerns about there being the 3, 4 as opposed to the required 6?
No, there is no concerns. There's actually 4 parking spaces in tandem, and there is parking on street, Bishop and Lohiel, so that can be utilized, except for the winter months, obviously.
It's the winter I'm thinking of.
Further, any further questions or comments? Councillor Manley?
Yeah, just to that, I think there's quite a space along the side of that building along Bishop. I believe that people park there along that side of that building or whatever. I think you can see that on one of the
It's very
photos.
wide. Yeah.
It's very wide. It's off our road actually, or whatever. It's off so shouldn't affect it, I don't think, looking at it. So.
Okay, final question. We can ask questions during the
Okay.
regular public meeting and planning. So we'll call an adjournment to this meeting. I have a motion moved by Councillor Massey, seconded by Councillor Manley, that there being no further business to discuss, the public meeting was adjourned at 6:44 p.m. All those in favor? Motion is carried. Okay, we will move on to the planning committee meeting. Is there any disclosure of conflict of interest? Seeing none, I have a motion to accept the agenda. I have a motion moved by Councillor Noble, seconded by Councillor Madden, that the Council of the Township of North Glengarry accepts the planning committee meeting agenda of Monday, January 11th, 2021. All those in favor? Motion is carried. And the ratify the minutes of Monday, December 14th. I have a motion moved by Councillor Wensing, seconded by Councillor Manley, that the Council of the Township of North Glengarry accepts the minutes of the Planning Committee meeting Monday, December 14th, 2020. Is there any discussion on the minutes? Seeing none, all those in favor? Motion is carried. Okay, zoning amendment Z01 2021. I have a motion moved by Councillor Manley, seconded by Councillor Wensing. It is the recommendation of Planning Department that the application Z01 2021 be forwarded to the Council of the Township of North Glengarry for further consideration and approval. Kasia?
Thank you, Mr. Mayor. So I presented in the public meeting. Any questions from the planning committee now?
Do we have any questions on this one? Councillor Manley.
It's just a comment, I guess. We talked before about these small severances or whatever. Is that what they wanted? I'm looking at the picture and thinking that that's probably the space that they wanted. But they didn't have any questions about a larger severance on this, Kasia?
As I remember, the applicant did want a larger area, but since, as you will see on the air photo, it's a green space that's being severed and the rest is pure farmland. So the counties weren't willing to accommodate a larger land area. Basically, there was no good justification. So it's the county,
You know,
3 acres.
can I ask how much more they were asking for?
I think it was about 4 acres.
4 acres.
4 acres more or 1 acre more to make?
1 acre more, so a total of 4 acres.
Okay.
Okay.
Any further questions or comments on this? Seeing none, all those in favor of the motion? Motion is carried. Okay, moving on to Z02 2021. I have a motion moved by Councillor Madden, seconded by Councillor Noble. It is the recommendation of the Planning Department that the application Z02 2021 be forwarded to the Council of the Township of North Glengarry for further consideration and approval. Kasia?
Thank you, Mr. Mayor. Does the planning committee have any questions?
Deputy Mayor, I believe you had a question at the end of that.
Yeah, I just would like to clarify the parking. Councillor Manley, you said that there was some extra space to park off street because like sort of, what is it, a boulevard or something?
Basically.
Yes. It's paved. Maybe Kasia, can you pull up one of those pictures, the pictures that shows the,
Yes, certainly. I will show
I don't think we had that picture in our package.
The reason I ask is because we can't, assume that anyone who rents one of those 4 isn't going to have a car, right? So, and we don't want them parking on street in the winter.
Everyone
maybe
able to see?
The other one is, can we go to the first one? I think there was one more there, right there.
Oh, I see. Okay.
There's a lot.
So all along that side there, there's,
So I guess my question is does anybody know, does Public Works plow where that car is? Like, does that get cleared in the winter?
I don't believe so.
I'm not sure.
We just don't want to be creating a problem for our snowplow drivers and then, have people parking.
They've been parking there for
yeah.
forever, and it's not a problem.
I don't believe so.
Okay.
I don't think that they would come up over that curb anyways. So
Okay.
there's just a slight curb there. So I'm doubtful they're going to come up over that.
So then it's up to the individual who parks there to clear their car out of there then, obviously.
That's right.
Yeah. Okay. Thank you.
Okay, thank you. Are there any further questions from members of the committee? Okay, seeing none. All those in favor of the motion? Motion is carried. Thank you. And this is adjournment. I have a motion moved by Councillor Massey, seconded by Councillor Manley, that there being no further business to discuss, the planning committee meeting was adjourned at 6:50 p.m. All those in favor? Motion is carried. We will take a 10-minute break. I encourage people to come back. We have Dr. Paul joining us at 7 o'clock for an update and questions from members of council. So we will start at 7 p.m. sharp. So please come back and join us. Thank you. Okay, good evening, everyone, and welcome to our first meeting of the year. Just like to take this opportunity to wish everyone a Happy New Year. It's we're starting off with a good start with being in lockdown, but let's look forward and hope that we can see some light at the end of the tunnel. I'd like to call the meeting to order. Are there any declarations of pecuniary interest or the general nature thereof? Seeing none, I have a motion to accept the agenda. I have a motion moved by Deputy Mayor Williams, seconded by Councillor Massey, that the Council of the Township of North Glengarry accepts the agenda of the regular meeting of Council, January 11th, 2021. Any discussion on the agenda? Seeing none, all those in favor of the motion? Motion is carried. Adoption of the previous minutes of the regular meeting of Council minutes, December 14th, 2020. I have a motion moved by Councillor Massey, seconded by Councillor Noble, that the minutes of the following meeting be adopted as circulated. Regular meeting of Council, December 14th, 2020. Are there any questions on the minutes of the December 14th meeting? Seeing none, all those in favor of the motion? Motion is carried. And delegations, I don't see Dr. Paul yet on the line. So we will just continue until he arrives. I believe he was presenting at the City of Cornwall also this evening. So we will have him as soon as he gets here. Moving on to staff reports, Treasury Department, Social Services Relief Fund. I have a motion moved by Councillor Noble, seconded by Councillor Manley, that the Council of the Township of North Glengarry accepts report TR 2021-01 from the Director of Finance Treasurer and approves the creation of a Social Service Relief Fund Reserve. Welcome, Kimberly. You are muted.
Hello.
There you are.
April 1st, 2020, the Ministry of Municipal Affairs and Housing announced the Social Services Relief Fund in response to the COVID-19 crisis. The township's allotment is $125,000, which we received on December 22nd, 2020. Although a good portion has been spent, there still remains some items that need to be completed. So I would like to put these funds into a reserve fund specifically noted for that purpose.
Okay, thank you. Are there any questions from the members of council? Deputy Mayor Williams. You are muted, Karma.
Sorry about that. Kim, what's left in this fund?
I don't have the exact number for you. I can probably provide it to you tomorrow, but these are for capital expenditures only. The other Safe Start program is for operating expenses. This is simply for capital. So it would be like the renovations to the front office and things like that.
Okay, any further questions? Seeing none, all those in favor of the motion? Motion is carried, and I see that Dr. Paul has joined us. Welcome, Dr. Paul, and thank you for joining us this evening. Look forward to your update.
Thank you very much, and thank you very much for accommodating me. I'm going to do 17 of these, but I think it's worthwhile. I think it's very worthwhile because I've been, as you know, I've been doing weekly updates for the mayors and CAOs, and I think I just want there's a lot happening, you know, and good news as well, but some bad news as well, but a lot of good news. So I thought it was a good chance to share some updates to you. So what I'm going to do is I'm going to start with sort of the local statistics, and then go down a bit more to sort of look at some of your area issues, and then I'll talk about vaccines and what I think is going to happen in terms of some of the new restrictions are going to be let out tomorrow, from what I hear from the ministry. So we'll take it from there. I'm just going to start sharing my screen if you don't mind. I'm just going to go to our local statistics and just show you that we're up to almost 700 active cases in our area, and we're almost at 2,000. We have 18 patients hospitalized, most of which are at the Cornwall Hospital, and 5 in the intensive care unit. We've had 38 deaths in our area. Tragically, most of them, if not all of them, in long-term care or retirement homes, which is the trend that we've seen across the province and across Canada for that matter. We have 14 outbreaks at this point in time. And the good news is that for the most part in the long-term care facilities, those outbreaks are because a staff is positive, and for the most part, we have negative. Is Lancaster your or South?
No, South Glengarry.
Because we've got that's the exception. We've got a lot of problems with that one. We've got a lot of positive cases there. But the other ones that we have across our area are mostly the staff themselves. As you know, we do routine tests, and some of them come up positive. And it's not surprising that we keep getting positive staff, because we know as the numbers around us increase, they creep in. They creep in, and we were seeing that with the schools as well. So just to sort of bring it down to our area, just to show you how dramatic our statistics are, over the weekend, and just between Friday and today, we went up 166 cases, 39 of which were in SDNG, 35 in Prescott Russell, 71 in Cornwall, and 21 added in Akwesasne. So this is huge numbers, for that. I mean, just to give you context, sometimes Ottawa has 80 to 90 cases a day, when they're considered a bit high. So we are having these numbers. Just to sort of go over, so North Glengarry has a total of 80 cases, but 29 active at this point. And you could see sort of that South Glengarry had more. The South Glengarry ones were due to actually large clusters, people partying, and we got like 8-10 cases out of one party and had a couple of those. But still, we still have 68 active cases. But if you look at North Glengarry, we're up to 29 active cases. No area is spared. The only one, for some reason, we had a couple of cases with East Hawkesbury, but everywhere else we've had cases. You could see Prescott Russell was sort of leading the way initially, but we now have activity in SDNG and a lot in Cornwall. Look, we're almost at 500 in Cornwall. And just to give you sort of a context, I'll show you kind of the way that the cases were. If you look at when we started our cases, we were kind of quite low, daily cases. And look how we've gone up. And if you look at the case summaries, you can kind of see, for example, if you look at the SDNG, it was relatively flat, and then upwards. So now we're up to 413 cases, and we had the same in Cornwall. Cornwall was like flat, and literally, we went into September, with less than 80 cases, less than 100 cases, and then all of a sudden, boom. This is where we are, and so that's alarming to us. But I can tell you that this is a similar trend we're seeing across Canada, across Ontario. The Ontario numbers themselves have been going up about 3,500 a day, which is a high level. It has stabilized at, but creeping upwards week by week. It started 1,500, 2,000, 2,500, and now it's been consistently about between 3,000 and 3,500. And so most of that is activities in the GTA, in the GTA area. But we have seen Ottawa, we've seen other areas around us with those numbers. So and as you know, we've seen a worldwide resurgence of the virus. Many countries have been talking about having more curfews and more lockdowns and so on. And that, unfortunately, is going to be what we're looking at as well. Let me also show you another one that I wanted to, another graph that's important. This is the one, when we talk about the yellow zone and red zone and orange zone and so on, one of the bigger parameters for it is kind of your number of cases per 7 days per 100,000. That's kind of it's called a rolling average, 7-day rolling average. So you could see kind of, around December here, we were initially in yellow, and then we went into orange, and then we crossed the red line here, and you could see we have an upward trajectory. Just to give you context, 40 is the limit for red. Right now, if you look at our overall numbers for the health unit, we're 140. For SDNG, we're 113. For Prescott Russell, we're 82 because some of the cases have gone down, but Cornwall were 280, like really high. And so this is clearly up here, gray zone, which is lockdown. That, you know, like whether or not there was a provincial lockdown, we would have had a lockdown. We would have been in gray. So it's very important for us to realize that. What encourages me is that I'm seeing maybe a lower tick going downwards a bit, like, you know, from this going down. I'm hoping that to continue, because if we, this is kind of 2 weeks into the curfew, if you recall, you know, Boxing Day. So we're trying to, you know, probably reflective of parties and those type of things. And then as we go down, hopefully we'll get some downward traction. But unfortunately, that is not the direction the province is going. The province is going a bit up. The hospitalizations are up. Like I said, we've got 15 in hospital right now. You know, 5 in the ICU, 18 in hospital, sorry, 5 in the ICU. The provincial numbers are going up. We've had 1,563 hospitalizations across the province. Our hospitals are, for example, the Cornwall Hospital, which is the regional COVID hospital, is above capacity with other cases as well. And so our fear is that if these trends continue or flatten, because, you know, they're, you know, adding 3,000 cases a day, you know, a certain percentage of those will end up in hospital, will die. So if you're doing that 7 days a week, you're adding 21,000 cases, and just by math, you can extrapolate it to increase cases, you know, hospitalized and those type of things. So it is a problem at this point in time. I'm just going to go through just a few other numbers that I wanted to share with you, and then I'll talk about some other things and then lead into the vaccine. But for now, I just wanted to just do a quick presentation here. So this one just shows you, again, this is a provincial data, and it kind of shows you our daily increases, and it's no surprise we're sort of going upwards this way. The next slide is what's called the reproductive number. The reproduction number is the number of people that one person can infect. So if you have a reproductive number of 1.5, let's say, one person, 10 people will infect 15 people, you know, because it spreads that way. So we want to keep it less than 1. And you could see that, you know, we were less than 1 for a while here, and then now we were less than 1, but now we went up. We were at 1.5. We peaked at 1.5. Now we're at 1.36, which is still not ideal. But if you take that in conjunction with our other numbers, that brings us into higher territory. This gives you an example. This is where we acquire it. Like, what people are asking me, where are these cases coming from? Where are these cases coming from? Well, for the most part, this kind of like dark green here is means it's close contact. And I'll show you some graphs later on. But the close contact is, you know, either household contact or at work or with a friend or visiting somebody. It's all close contact. And you could see that, you know, the orange here is where we don't find a link, which is a minority. And the light blue here is where we have outbreaks. And we know where we had the outbreaks, mostly long-term care facilities, right? But so the message here is that most of the cases in the community are there. The purple is travel, and you can see that it's decreasing. It's very low, but as compared to when we first started, we had a lot of our cases were travel related from the United States coming back and so on. To compare this to the Ontario numbers, this is Ontario, and I'm just showing you this because it shows us that again in Ontario, most cases were travel related, and then there was a bit of a peak of travel over the summer. But you could see that this dark green area is the close contact. But then again, you have a large number here of gray, which is missing information, and that's because health units like Toronto and Peel are overwhelmed and they can't do the contact tracing, so they can't get the information. And that's why it's important for us. If you look at ours, we're maintaining it. We have very little missing information. We're struggling to do that. We have a team of 30, 40 people just doing contact tracing, but we're keeping up with it. So we know where most of the cases are coming from. And that's very important for us. The other one is the rate of positivity. How many people are positive that are tested? So this is a graph that shows us the number of tests that we do in our area on a weekly basis. And this dark line here tells us the percentage of people that are positive. And you could see that initially we were quite low, and then we're going up now, and then we doubled over the last couple of weeks. And interesting what we're seeing, again, we're kind of here, we're kind of top 12 out of 34 health units in terms of that. You could see that the top ones, Peel, Toronto, York, they're quite high. The average is 7% in Ontario. We're still lower than the average, but you could see that we're in the top, I would say at least, third or so in terms of numbers. This is an interesting one. This is, again, just shows us the positivity percentages across the province, across all health units. So you can see the tendency of it being higher as we move forward. And then this is an interesting one because you could see this red one in particular is young kids. Their positivity has gone up, and that was like right around when school finished. So a lot of them get it from the community. And that's what the problem is. That's why we were hesitant to bring kids back to school, because we knew that a lot of them were positive from the community. Teachers were positive from the community. And like I said before, from the long-term care settings, what we saw was individuals who were, I'll go back to this one, were individuals who essentially had contact with others, and then went to work and spread it at work. That's what we saw. Whether it was a school, whether it was a long-term care facility, and so on. So that's one of the things. Now, the other thing that I just wanted to share with you is something that we just released today. It's kind of fresh off the presses, but I just wanted to give you kind of an overview. We're going to publish this properly, and we're going to have it on our website. But this kind of tells you, looking at the cases between August and January, hard to do because the system that the ministry gave us is very clunky. It's very difficult to extract this, but we did. So what it shows us is that from all the cases, we're trying to find out, like, how did they get the cases? Like, where were the cases contracted, right? How were they contracted? Well, about almost 2/3 of them were close contacts. So if you kind of extrapolate this, now the healthcare setting is long-term care, because we had a couple of big long-term care outbreaks. But you could see that air travel is very low, unknown is very little. The majority here are close contact. And then of that, if you look at it, more than half of this close contacts, okay, or household contacts. And you could see kind of like almost a quarter and a quarter in terms of those, like almost making 25% of all the cases where they were either close friend or associate. So they went out for a coffee, they went to a friend's house, they went to visited, those type of things. They got it there. And about 11% total, which is almost like a quarter of the whole circle here, is workplace. So what's happening is, although these individuals represent 25%, okay, what they do is they go home and they infect their home. So we've got like somebody going, getting it at the work, coming home. They had we literally had families that had 5 kids, 6 kids, 7 people living at home. They all were positive. They all became positive. So like one case, I call it the multiplier effect. And that's how we get those clusters of cases. So that's important. And so this is the average of the East Ontario Health Unit area. This breaks it down into Prescott Russell and SDNG, and you can see SDNG is 68%. It's similar, and here half the cases are of the close contact at household, and we get a lot of them are friends and family and partying, those type of things, and about 10%, about 13%, which is about a quarter of all of these here, are again workplace, where again they get it from another person. So I want to stress that in workplace, it's not really a source of like outbreak. So let's say a worker working at a place, when they deal with clients, they're fine because they wear all their masks, no problem. When they go like to have lunch, or they carpool, or they go out, they smoke, whatever they do, they forget about the fact that these people need to socially distance, and they don't. And they tell us this. So we were feeling fine. We didn't have to, we thought we could just have lunch together or whatever. And what happens is, lo and behold, one of them gets sick a day or two later, and they were infectious a day or two before without knowing it. So that's why it's important for us. That's kind of why I call it one of our blind spots. But you can see that it kind of multiplies into more cases because they go home and they infect their household. Because it's contagious in that context. And then we got the same for Cornwall as well. So these are numbers. And then the other thing that we're looking at is kind of community exposure, other exposure. And you can kind of see here that, I just want to show you another one, like here for SDNG. Again, it's more contacts, schools, and not many work, not many of them in terms of settings where they told us. But we know that the other one, it's a bit confusing, is who they got it from, and the other one is where they got it from. But in any case, it just goes to show you that we still have potential exposure, and that's what we're seeing today. So out of those cases that I showed you that we added today, I asked my staff, and like, for example, most of them were from household contacts or close contacts, like that. And only a few and actually there were some in Cornwall that was at one workplace and a restaurant. So we don't have outbreaks at these, like, unlike Toronto, where they have big outbreaks in like restaurants and workplaces. We don't have any outbreaks. What happens is those individuals, we isolate them, they go home, so they don't spread it at work, but they spread it at home. And there's no choice, they live together. So that's where we are with that. And so one of the things that we're trying to do now is, obviously, I just want to give this up here, is obviously trying to get the message out there that we need to continue to make sure that it's mobility. What we're seeing is people are going out, people are mingling, and although you could see it's about, a relatively small percentage, but it's 25% still of people mingling with others, and that they need to be careful. You have to stay home and so on. So one of the things that I'm hoping that our numbers start to go down with the lockdown. But what we can tell you is that despite the lockdown, mobility data, there's data that follows people with their cell phones and how far away they go from home is actually has increased over the last couple of weeks. So the more people are mobile, the more they're going to intermix, the more they're going to spread it. And that's really our fear, and that's what we're trying to do. So we had a meeting over the weekend, and the Premier spoke to us. We had a meeting with the Premier was on the phone and was saying that he was quite worried about the situation, and that we're going to contemplate other restrictions, which would include perhaps stricter orders to stay home, likely not a curfew, but that's on the table. Quebec, as you know, has one. More businesses being deemed non-essential and having to close or work from home, forced to work at home. Perhaps tapering some of the Walmarts and the Costco's and just limiting it to groceries and pharmacy sales like they do in Quebec. Limiting the number of people that go into the store. One person per household shopping, and really no get-togethers at all. Prohibited. So that's what's going to be announced likely tomorrow. I think they might even, I don't know how they're going to do it, declare an emergency or whatever, but that's what they're going to do. And so tomorrow there's going to be some announcements, I'm pretty sure, about more restrictions coming in because we can't let this go unsustained. It's going to overwhelm our healthcare system. It's starting to even overwhelm our local hospitals right now. And it's going to start, the effect is going to be, we're going to have to stop elective surgeries and cancel all those things as well. So that's the sombering news is where we are with that. But I'd like to sort of end off with some good news because, the light is at the end of the tunnel, and, whatever we're going to do now is temporary. So I think what we're going to see is the vaccine numbers going up and those numbers going down. And I just wanted to give you a bit of an update of where we are with the vaccine. As you know, there are two vaccines that are available. One is the Pfizer vaccine, one is the Moderna vaccine in Canada. They're trickling out because were just accepted, from Health Canada. And so we have limited supply initially. And there is a bit of a rollout. We have not had our vaccine supplied us. They had only started it in Ottawa, Toronto, and some other high areas, but we're next. We're getting vaccine this week. Actually, we're waiting for it tomorrow. And our mandate has been to start with our long-term care. So we've already got our SDNG and Prescott Russell EMS ready to go. We've trained them. We've given everything to go. As soon as we get the vaccine, we're going to start progressively vaccinating all our long-term care facilities and then our retirement homes as well. The ministry, the general himself gave us a mandate to vaccinate all of them by February 15th, but I believe we'll be able to do it much quicker than that, first shot. I'll be able to do that quicker than that. It's 2 shots. One is 21 days apart, one is 28 days apart, and we're itching. We're just ready to go. We've got everybody ready. Our team has been working all weekend because we were told last minute that we're going to get the supply. So we're working all weekend to start vaccination, which is the good news. And we're also going to start vaccinating progressively our high-risk healthcare workers, people working in ICUs and so on, moving forward. So once we got that, and I took the timelines out because initially the timelines were like March, like here, March, April. This is because they only are doing it based on Pfizer and Moderna. There's 2 other vaccines that are going to be accepted very shortly. So that's going to add to our capacity. So it's going to push things a bit to the left earlier. So the good news is that we'll run through these. We'll do the healthcare workers. We'll do the congregate living. You know, First Nations, we get special supply because we have Akwesasne, as you know, and we're going to do the adult, you know, the home care recipients. And as soon as we start, you know, we're finished with this, we're ready to do essential frontline workers, adults over, you know, 70, depending on age group, at-risk populations, and then the general population. So that's when we're going to have like millions and millions of vaccines coming. And like I said, they're predicting kind of this like, you know, loose sort of March, April. I'm saying February, March. That's what I'm saying. You know, we're going to be here, like starting to vaccinate more people. So, and as you can see, initially it's done more in hospital clinic sites and in long-term care. So that's why we're doing it, because of who we're covering. But then we're going to be taking it to the community, you know, taking it to essential workers, you know, firemen, police, and so on, moving forward. And it's public health that's going to lead it. And then we're going to start doing mass immunization clinics. And this is where we'll be collaborating with all our municipal partners for, you know, maybe looking at locales and speaking to you. At this point, our mandate has just been to get it out, you know, do the long-term care, which I think is right, because they're the ones that are dying. And they're the ones that are most vulnerable. So as soon as we get that done, I'll sleep better. I'll be honest with you, because I get very nervous when I hear we have homes, you know, all of a sudden, like at Prescott Russell home, we lost 15 people in 2 days. In Plantagenet, we had literally 10 deaths in a span of 6 hours. It was terrible. You know, this kills the elderly. So if we vaccinate them, vaccinate their workers, vaccinate their visitors, you know, the central visitors, it'll be much better, because at least we'll be able to take a deep breath and not worry about it going into to their homes. And then we'll be able to do, like I said, I want to do the essential workers, police, fire, you know, frontline, you know, as soon as we can, and then roll it out to the rest of the population. And by the time we get to kind of April, May, and I think earlier, between me and you, we're going to be offering this through doctors' offices, pharmacies, so it'll be universally available. So I think that light is right there. It's not like farther now, it's there. And so despite the fact that we still, however, between now and probably around this time here, like so probably May, we still have to do physical distancing and so on, because we won't have vaccinated enough of the population. But I think that's where we are, will be. And it's good news for us. And I know that there's a variant out there, because people might ask me what the variants that you're hearing. Fortunately, those variants have changed, not in how severe disease they do, more in how easier they spread. And they haven't changed in the way that they look. So the vaccine is still effective on it against it. So that's the good news. We haven't had any of the variants in our area. We've had, I think, 2 or 3 cases that came from Britain in Ottawa, and a couple, I think, in Toronto, and that's it. So far we're good. We're going to be, this is to me a big exercise. Our staff is fully pumped to do this and ready to go. And we'll be calling on you as well, giving you more updates, and also speaking, you know, with your frontline workers and high essential workers, and also perhaps, you know, maybe needing some of your facilities to vaccinate and so on. So we're not there yet. Right now, we're planning, we're doing the phase 1 and then phase 2. Once we have the phase 2 more concrete, I'll be coming back to you as well. But I wanted to give you an update right now. This is kind of state-of-the-art update, and I will be more than happy to take your questions.
Okay, thank you, Dr. Paul. We very much appreciate the update. It's good to hear that there might be a light at the end of the tunnel. I have a couple questions to start.
Sure.
Is that something that you think will happen with the big box stores? going, we saw pictures from the police in Hawkesbury with Quebec plates, and the same, we're seeing it in Alexandria at Giant Tiger and at grocery stores as well. It's significant in Cornwall.
Yeah.
Because they've done what their end, where it's just a grocery and pharmacy.
Mayor McDonald, I have been complaining to the ministry about this since they started the lockdown. I actually recommended that when they did the lockdown, they immediately force those big box stores to only sell essentials, groceries and pharmacy products, like they have in Quebec. They've done it in Quebec, and that's one of the reasons they're coming here. I believe that was one of the recommendations that was made over the weekend to the government, and I'm hoping that they follow suit with that, because that's going to A, level the playing field, and B, decrease the mobility into our area. So I'm fully supportive of it. As a matter of fact, I sit on the public health measures table, and we had an emergency meeting on Saturday, and I insist that was one of the recommendations we made, including also limiting one person per household going and shopping. We've seen people going with families, and this is not normal times. So yes, I'm hoping that will be part of the announcement tomorrow.
Thank you. And the second question, just as part of that announcement tomorrow, is there any discussion that will they be shutting down construction and manufacturing?
That's something that they're going to be looking at, and they're going to be looking at perhaps non-essential manufacturing and non-essential construction. That's on the table. But again, that's the cabinet's deciding today.
Okay, thank you. I'm sure there are other questions. Councillor Manley?
Thank you, Dr. Paul, for your update. Been watching you on Facebook too, and it's been reassuring to see all your updates. I noticed in the news in the last couple of days, there's been a lot of talk about restricting travel within Ontario.
Yeah.
Do you know if that was at the table as well?
Yes, it was. Interprovincial and intra.
Right.
I recommended perhaps having limit from your house, 5 kilometers, 10 kilometers. That would at once address that, plus interprovincial travel.
Yes. Okay.
Yeah, but I don't know what they're going to go.
Right. Yeah, exactly.
That was on the menu, and then the cabinet
on the table,
decides. Yeah. Okay.
Are there any further questions? Councillor Massey.
Yeah, thank you, Dr. Paul, for your update. I just saw something today too, that some of the recommendations that they're gonna try to implement is shorter hours for like essential stores, like just if I can give you my opinion on that. I have a retail store, and it's quite busy from 9 till 5. So maybe if you could bring that to the table. If we reduce hours, it's going to squeeze more people together. I think if anything, it should be not really longer, but I don't think that's a good idea, because in my case, it's going to make more pressure on people to jam up in the store and everything. I don't have a big store, so.
I agree. One of the things, I've got the document here in front of me. It's one of the things on the table was curfews. Obviously, curfews is one of the table, which I don't think they're going to go for. And the other one really is condensing businesses. I believe that what should be done should be something that doesn't encourage, crowding, like you said. And I think the more logical thing would be not to have either a curfew or business closures early, but to have strict guidelines as to not many, go out when you're essential, those type of things. You know what I mean? Because even if you had a curfew, nothing stops you from crowding during the day. It's the same thing as shrinking your operating hours, right? Mm-hmm. So I believe that it should be more widespread enforcement and checkups on people, like, what are you doing outside, those type of things, rather than limiting it, because then you're right, you're going to compress it all into the one time.
Yeah.
Again, that's on the table, but that's what they're going to be looking at.
Thank you.
Thank you. Deputy Mayor Williams, then Councillor Madden.
Thank you, Mr. Mayor. Dr. Paul, I'd like to thank you once again, you and your most capable staff, for doing your best to try and keep this unmanageable situation manageable. I'm really glad that you're focusing on long-term care with regards to vaccines first, because as you mentioned, they're certainly the most vulnerable. Just a question with regards to where we stand with our seniors residences and long-term care. Is COVID in every single one of them, Dr. Paul?
No, we've got, we have, right now, we're at, I printed it upstairs. We're 14 or 15 homes right now. And not all of them, but it's more than we've ever had with COVID. Okay. The good news is that in most of them, we picked it up on testing, the routine testing we do for the staff, and we've been able to not have it spread within it. That's the good news. However, we've got a couple, the one in Lancaster, Glenstore Dunlodge, and there's one other one where we had a couple of cases, the Akwesasne one actually, where we've had cases. So the number is scared. When I looked at the number, I said, oh my God, 15 or 16 an outbreak, but we're able to, thank God, we have the mechanisms in place. So as soon as we have one staff positive, even if they're asymptomatic, we declare an outbreak and we pretend that everybody has COVID. So, and we test them. So far, knock on wood, though the majority have had 0 residents, which is good. But, it's only a matter of time. The more you challenge it, when it's out there and people bring it in, the more you're going to potential spread to the vulnerable. So that's why you're right. I'm so focused on long term. Like we've got our ready to go. As soon as we get the vaccine, off we go.
Thank you.
Thank you. Yeah, Councillor Madden.
Thank you, Mr. Mayor. Dr. Paul, quick question just about resources. You had mentioned you have a team of 30 or 40 who are devoting their time and efforts to contact tracing. Is there any, are there any resources that are being devoted to ensuring that quarantines are being respected and people are being smart about this?
Yes, we have another team called the enforcement team, which is different, and it's and we work with law enforcement. We also have had examples, and I'll be honest with you, where, for example, when we ask people to quarantine or we call them for contact tracing, they tell us to F off. They're not very nice to our staff, and the OPP goes to their door. Let's put it this way: there's an order that I've given. If you, that's a $5,000 fine a day. I mean, I'm sorry, I don't want to do that, but people have to be responsible. They're positive and they give our staff grief, and they hung up and I don't want anything to do with you. And so we send the police. So we're working with all your bylaws. We're working with bylaw officers. We're working with the police, OPP, and we had in December, and actually we're going to release the report, is not only for quarantine, but also for for workplaces. We did a blitz of several hundred businesses, and we found about 40% had issues. They were corrected on the spot, but we're going to be doing that again, and that was done with extra enforcement help from government. They have an interagency force that came. I think they had 17 or 18 of them that came to our area December 3rd to 5th, and we learned a few things. Our biggest, I'll be honest with you, the biggest people that were not compliant were gyms and restaurants, but they corrected them. So now we're gonna go back. So yeah, so we're spending a lot of time on enforcement, particularly in the quarantine. I have an order. There's an actual order that I have, and I have to give it to the OPP. Have been unbelievably cooperative. They go to the house. You got to call when the OPP shows up at the door. They change their tune. Unfortunately, we have to do that.
Yes. Thank you. And I just want to say that I think that's a message that it's not a nice message, but I think it's a message that needs to get out there, because I think there are some people that are not respecting this, and
No, they're not.
people need to understand this a little bit better.
Yeah. Great.
Thank you.
You're welcome.
You. Councillor Noble.
Good evening, Dr. Paul. Thank you again for all the information. I have a rant, and I'm not going to do it. And it's not about you. It's just about some of the I don't know, some of the rules and regulations that came in that don't seem to follow this 2018 response plan that had been in place. But what my people always complain about is that, and especially out here where I am, in a very, very, very non-densely populated area, that we get lumped in with the bigger areas, which is fine, I guess. It's the way it has to be. I mean, I work in Ottawa, but the second thing that I hear about is my seniors. So like pardon me, I run a library that has a membership that is about 90% 70 and over. And they are the ones that are hurting the most. They haven't seen grandkids in forever. Some aren't mobile. So when they were actually getting out, that was the weekly thing. That was their one thing they got to do. And I know the phone lines were burning around here between March, April, and till about the end of April, beginning of May. But then that died out when the nice weather came. It might happen again, but some aren't techie, so they're not doing Zooms, they're not doing anything. And so, and we are losing some because there is nothing to do. They're locked up in their LTC. So my question is really about the balance. Was anything discussed over the weekend, over before, if there's some way to find a balance that we can let people have their family visit in the hospital if they can't do the Zoom, especially if they're coming to the end. The LTCs, the ones that, again, some of these guys were locked in their rooms, having meals delivered to their rooms, not even being allowed to go in the lobby, go for a walk, go outside, and mental health. I mean, I'm a travel agent, so I haven't worked since April. So things are starting to get a little Groundhog Day in my world, but I'm mobile. I can go get groceries. I can do stuff. Some of these guys can't. So I can't stand the idea of lockdown or even more restrictions thinking of these guys, but where is the balance between mental health? What have you guys discussed about letting seniors have visitors, letting somebody, especially out here in a population of 100, having some visitors or doing something?
Well, I can tell you that it's not the first time I've heard that complaint, and I can't tell you that I disagree. I agree. It's very difficult, but on the other hand, I have to tell people that people died. So it's like the balance. So we had a bit of a balance there where we did allow visitors go in, essential visitors. We do allow them, but now with the zones getting higher and higher, we're restricting that, but we're still allowing essential visitors to go in. So that's a big win as far as I'm concerned. Now, the biggest solution to that, and I do recognize, I'm not dismissing the mental health and all that, but you know what? I was just talking about vaccines. And as soon as we start getting those and protecting everybody, the sooner we get it done, the more we're going to be able to open it up. That won't solve it in the short term, but I do know that we do allow essential visitors and others in there. And I do know that, for palliative reasons, people can go in. But again, I know that certain pockets of our population have less than others. And we've always been told, like, why punish us when then? Because what happens is, like, if you look at other areas, I found out today that they had out of Toronto, all of a sudden, Oshawa and all the other areas got inundated with people. So that's why, and that's our issue as well. But I do agree with you. And I think that we do allow essential visitors in, and although it's a bit more restrictive now if it's an outbreak, but at least that's better than it was. So the government kind of looked at that. I'll be frank with you, we didn't look at that this weekend. The main focus was what are the lockdowns, and the general told us you got to go vaccinate long-term care. That's what we were talking about this weekend. So there is that bright spot there, and that's why we want to get them first, because they're the most vulnerable. And you know what? I'm not only limiting it to long-term care, because we know that elderly is at risk, but elderly plus congregate living is a higher risk. So that's why we're going to go elderly in the congregate living settings, both long-term care and retirement homes. We're going to do both. Okay. And then as you saw on the graph, the next swath is people over 75, over 80, living at home and all that. Those are the ones we're going to get to first. So at least they can be protected and then be a bit more safe to visit and so on. But I agree with you. Same could be told about kids not going to school and, mental health and all that as well. So we got to balance it. It's very difficult.
Thank you.
Thank you.
You're welcome.
Perhaps Councillor Noble, if you want to sell some travel trips, maybe just send out some invitations to other politicians, because they seem to like to travel. So
My best.
are there any further questions from members of council? Okay, seeing none, thank you very much, Dr. Paul. We very much appreciate it, and continue the good work, and hopefully we get those vaccines out sooner rather than later.
Yeah. I can't wait. Take care. Thank you very much. And thank you all for your support. Bye-bye.
Thank you.
Okay, so we will continue on with the regular meeting. So moving on to item 2, staff reports, support of extending 0 Reg 58817 asset management deadline. And Kimberly, I will get you for this. I have a motion moved by Councillor Manley, seconded by Councillor Madden. Whereas the COVID-19 pandemic has had significant financial and operational impacts on Ontario municipalities, and whereas municipalities have had to divert resources towards addressing the immediate needs of the pandemic and maintaining service delivery despite evolving restrictions and limited funds, and whereas the Government of Ontario has delayed timelines with respect to several pieces of legislation, and whereas the Government of Ontario has regulated municipal asset management through OREG 58817, asset management planning for municipal infrastructure under the Infrastructure for Jobs and Prosperity Act 2015, and whereas OREG 58817 mandates every municipality shall prepare an asset management plan in respect of its core municipal infrastructure assets by July 1st, 2021, and in respect of all its other municipal infrastructure assets by July 1st, 2023. And whereas the key components of an asset management plan as required by the regulation are infrastructure asset inventory, levels of service, life cycle management, and financial strategy. And whereas there is a concern amongst Finance Officers Association of Ontario members and their municipalities that current capacity challenges, redeployment of staff, and lack of available resources will result in limitations for purposeful asset management planning. And whereas Ontario municipalities do not anticipate the current capacity challenges to be resolved in the short term. Now, therefore, be it resolved, the Council of the Township of North Glengarry supports MFOA's letter to the Ministry of Infrastructure requesting a 1-year extension of the deadlines in OR 58817 asset management planning for municipal infrastructure under the Infrastructure for Jobs and Prosperity Act 2015, so that all municipalities can focus on the immediate needs of the pandemic and engage in municipal asset management planning when capacity challenges are resolved.
I think you're on mute for part of that.
Yeah,
I think you forgot paragraph 2.
yeah, yes, ma'am. All right, the lowdown on that.
Okay, so the province implemented the asset management planning for municipal infrastructure regulation 58817 on January 1st, 2018. July 1st, 2019, we had to have a strategic asset management policy, which we did meet, that's fine. For July 1st, 2021, we have to have an approved asset management plan for core assets, including roads, bridges, and storm. It includes levels of service and cost of maintaining those services. Most municipalities in the area, this document is about 100 pages long. It's very in-depth. It's very technical. The Municipal Finance Officers Association has requested that we get an extension on this because there's been extensions on everything else by like 6 months to a year. And they're not willing to do this right now. So we're kind of lobbying for this. Honestly, we had our IT asset coordinator who resigned in June last year. I don't have any resources to do this except myself, and it's a huge undertaking. So all of SD&G, like the townships, have got together, and we possibly can't do this with the resources available. Also, their challenge is getting even consultants, because at this point in time, they can't come into our facilities. They can't see what we have. They can't, they can't do it. So anyways, this is a big deal. We're trying our best, but SD&G County can't do it. They will do it. I will do my best to do it, but the implications are that funding will not be available if we don't do it. So it's a huge undertaking. What we're requesting is a year extension to give us the time to do it and get the resources available to do it.
Okay, thank you. Any questions, Councillor Manley?
Yeah, Kim, when you say funding won't be available, are you talking about provincial funds to the township?
They have not stated that there will be a penalty, but the implications are if we do not get this done, there could be.
Okay. Any further questions? Seeing none, all those in favor of the motion? Motion is carried. Thank you.
Thank you very much. Appreciate that.
Okay, moving on to bylaw, temporary borrowing bylaw for 2021. I have a motion moved by Councillor Madden, seconded by Councillor Winsink, that bylaw 01/2021 being a bylaw to authorize temporary borrowing from time to time during the fiscal year end ending December 31st, 2021 be read a first, second, and third time and enacted in open council this 11th day of January, 2021. Kim?
This is a formality. Sections 407 of the Municipal Act provides authority for council to authorize temporary borrowing. This basically allows for temporary problems with finances, such as between the taxes coming available in, say, February, and maybe severe snowstorms where we need, some extra funding to help us out until we get taxation dollars. So this is just a temporary borrowing bylaw to allow us that flexibility to have it if we need it.
Okay, thank you. Is there any questions on this motion? Councillor Massey.
You, Jacques.
Just, thank you, Mr. Mayor, just to make sure that when there's a major expense we had taken out of that borrowing, that money borrowed, it's going to come to council, right? It's just that money that's going to.
I'm actually what happens with this is it's just the cash flow. For example, so let's say we have a significant snowstorm
Okay.
and we have to spend that money, but we have to meet payroll, we have to meet the electricity bills, we have to meet the telephone bills. It's that kind of bridge financing. So it's not an extraordinary expenditure. It's just until we get taxation dollars to make the money come.
I don't understand with the taxation part of it, but it's
all
maybe a big snowstorm.
it's all budgeted, Jacques.
Yeah, that's what
It's a budgeted
Budgeted.
expenditure. Sorry, it's a budgeted expenditure, but it's the timing. So, over the year, you might have, whatever dollars for snowstorming, but if it happens all in January, we may not have the cash flow to allow it. So this allows us to manage
Okay.
the cash flow to deal with it through
My
the.
question is, we are going to be aware of this situation before we.
Jacques, we're never made aware of this. It's basically like having a line of credit.
No, I know, Jamie, but if we're busted our budget on snow by the end of January, I would like to know that we're taking money to pour
But
it back.
that's a different item.
But
We'll get a
it-
report, just 1 second, please. We'll get a report from the treasurer telling us that we're over on expenditure. They're not going to come to us and say, listen, we're only getting our taxation on January 31st, the first lump sum. They're not going to come and tell us like we're $300 short and it comes out of that amount. It's budgeted items.
I know, that's what I'm asking the question. If we are busting a budget somewhere,
Go ahead.
If you're not going to be busting the budget in January, over the year, you might be, but that will be brought to your attention. But in January, if there's a huge influx and we planned for, say $100,000 over the year, but in January, we're hitting 90, we've got payroll, we've got all these other expenditures. This is just kind of like a savings account that floats us through until we get taxation dollars, which is part of the budget, and we'll be fine.
no, I understand that part. It's just that as long as, no.
Council will be aware of any problems for sure.
Okay, thank you.
Okay, any further questions? Seeing none, all those in favor of the motion? Motion is carried.
Thank you, Mr. Mayor.
Thank you. Moving on to planning, building and bylaw enforcement. I have a motion moved by Councillor Winsing, seconded by Deputy Mayor Williams, that the Council of the Township of North Glengarry adopt zoning bylaw Z13-2020 and that bylaw Z13-2020 be read a first, second, third time and enacted in open council this 11th day of January, 2021. Kasia?
Thank you, Mr. Mayor. So the zoning amendment Z13-2020 was approved by the Planning Committee last year on December 14th. I received no further comments from the public. Thank you.
Thank you. Any further questions on this? Seeing none, all those in favor of the motion? Motion is carried. Moving on to zoning amendment Z 14, 2020. I have a motion moved by Deputy Mayor Williams, seconded by Councillor Massey, that the Council of the Township of North Glengarry adopt zoning bylaw Z 14, 2020, and that bylaw Z 14, 2020 be read a first, second, third time and enacted in open council this 11th day of January, 2021. Tasha.
Zoning amendment was adopted by the planning committee on December 14th last year. Likewise, I did not receive any further comments from the public.
Thank you. Any questions on this zoning bylaw? Deputy Mayor Williams.
Thank you, Mr. Mayor. Kasia, I'm looking at the diagram here where the new buildings are going to go.
Yes.
And I know that that there's been an added 30-meter buffer zone that is required around the wetlands and the floodplain. I'm just curious because it's really tight along the west side there, all along the west side of that development. And I'm just wondering if the parking lot associated with the larger building on the south is actually venturing into that that buffer zone, that 30-meter buffer zone. It's impossible to tell from the diagram, but it's a big parking lot. And I'm just curious as to whether this was designed before that buffer was put in place, or whether or not I'm sure it was designed before, but I'm just wondering if it's accurate.
Yeah, definitely. So the area does definitely appear to be restricted, but I spoke to the consultants and I spoke to the RCA as well as the EIS consultant. So the drawings currently, they are only preliminary. The parking will not be going into that OSX space since site alteration is also prohibited. So it will have to be accommodated in an area that does permit some kind of site alteration. So definitely no site alteration of any kind in that OSX zone, even though it does appear tight, but I did call the consultant and make sure they are aware that the space is limited.
Okay, and we'll get a further look at all of this come site plan, I'm right?
Correct,
Okay,
yes.
very good, thank you.
Okay, thank you. Any further questions? Councillor Madden.
Just a quick comment, Mr. Mayor, to follow up on the Deputy Mayor's question. From that figure 2, the proposed site plan, it looks like the heavily dashed and lightly dashed line that goes around close to the roadway is the proposed 30-meter boundary. If I go back and forth between the two pictures where it's color coded, I think that's the boundary.
Oh, yeah?
Looks like it. Yep.
Okay.
Okay. Thank you, Councillor. Any further questions or comments? Seeing none, all those in favor of the motion? Motion is carried, none opposed. Okay, moving on to Public Works Department. I have a motion moved by Councillor Massey, seconded by Councillor Madden, that the council receives report PW 2021-01, award of tender 2020-09, purchase of a sidewalk tractor, and that council authorize the acting director of Public Works to execute the purchase of a sidewalk tractor with all specified attachments, including the provisional item of a rotary broom from Holder Tractors, Inc., for a total amount of $140,000, $804.11, excluding HSD. Dean. Dean, are you there?
Yeah, sorry about that. Coming on. There we go. Thank you, Mr. Mayor.
Welcome.
So staff issued a tender for the purchase of a sidewalk tractor to replace the aging unit that we have. We received 4 bids ranging from $127,974 to $169,900, which are all under the budget amount. 2 of the suppliers brought in a demo unit so our staff could get some seat time on them. We are recommending going with the Holder unit, which was the lowest bid. This unit will come with a V-plow, a blower, sanding unit, and a dump box to fill up at the shop, and then they can dump in to the spreader when it's empty. The unit also comes with a 2-year warranty compared to all the others with a 1-year warranty. Since we are under budget, we're asking to add the rotary broom, which was a provisional item. This item is $12,830. This broom can be used year round. It could also be used in the winter when there's a light dusting of snow to clear out the sidewalks instead of going out with the plow. Thank you.
Okay, great, thank you. Any questions? Councillor Massey.
Yes, thank you, Mr. Mayor. To Dean, the question, apart from the price, I know the price is a good price. It's the lowest of the prices, but is it still a good machine to work with, or it's not just a low price?
We've talked to a couple of municipalities. They are happy with it. Obviously, the higher price one is the Cadillac, but it's still a good unit. Our staff tried it out. There was some pros and cons for each unit, but they'll be happy with this unit.
Okay, good. Thank you.
Thank you. Any further questions or comments? Councillor Madden.
Just a quick question, Mr. Mayor. Thank you. Dean, that the rotary broom, I presume that's an articulating head, so it can be directed. It's not just a straight ahead thing for that price, I'm hoping.
Through you, Mr. Mayor. I'm actually not sure about that. I'm not sure. I'll have to look into that.
Would it be a usable thing if it's not articulating, if we're just pushing it straight ahead?
More than likely, it would make sense that it is an articulating unit. I don't have it in front of me, but I'll double check on that to make sure though.
Okay.
Thank you. Any further questions or comments? Seeing none, all those in favor of the motion? Motion is carried. Councillor Noble, did you have a question at the end there?
Well, I was just going to ask Dean, this is, well, it's pre-budget, but it's budgeted. You still have room. I guess there's a backhoe that's due. You still have room for other equipment in the budget?
Yeah, yes, we do.
Did we pass the budget? Yeah.
Once the budget's passed, yes, there'll be other room for other items. Yes.
Thank you.
Thank you. Okay, so we are moving on to the consent agenda. I have a motion moved by Councillor Massey, seconded by Councillor Noble, that the Council of the Township of North Glengarry receives the items from the consent agenda for information purposes only. Are there any questions on the consent agenda? Seeing none, all those in favor of the motion? Motion is carried.
Mr. Mayor, I have a question, please.
Yes, go ahead.
Just with speaking about the budget and this lockdown and our inability to meet face to face, are we going to? I'm hoping that we'll postpone budget deliberations until we can.
We
No?
cannot. We need to move forward with it. The budget is fairly straightforward, and I think it won't be as confusing as when we met with going through that farming document. The treasurer had met with me today and asked that we meet by Zoom and see if we can get the budget done that way.
But
Can I speak, Mr. Mayor?
Sure, go ahead.
The budget is near enough complete. You'll be getting budget documents by the end of the week, hopefully. But the issue at hand is if we delay it anymore, you can't get contracts in place for roads and things like that. So we cannot delay it. It may be by Zoom, so be it. But with the new trade agreements, we need to have like 30 days 30 days to advertise, and then you're limiting the Public Works Department to get roads done and things like that. So we're going to be moving forward as soon as we can. I talked to the mayor about it, and if it has to be by Zoom, it has to be by Zoom, but it'll be advertised for January 28th, and we'll see what happens at that point.
Go ahead, Deputy Mayor.
well, pardon me if I disagree. If this lockdown is if we're lucky enough, which probably we won't be, but I would like to think that if we can meet in person in February, I wouldn't think that we should let it go past mid-February. But if we can, personally, I would much prefer us to meet in person. it's difficult to have the kind of discussion you really need to have without it becoming either confusing or rushing through things that actually require proper discussion. That's just my 2 cents. I'd like to know what the rest of council members
Noble?
think.
Yeah, no, I'm just wondering if there's some way to do a hybrid. I mean, first of all, the arena is large enough to accommodate everybody, but whatever. But if you could at least have 2 people in a very, very large area, don't even have to be sharing the Wi-Fi, or 3. I mean, you guys are obviously going to do it from the town office, but some way that there can be a little bit of discussion, because I mean, the back and forth, the internet connection, the fact that we're only this big, it's going to be tough on Zoom, and especially with the budget, you've got line by line. And I totally get it, Kim. I've heard from the other angle too about, you know, if we wait too long, well, then everybody else gets the job before we get it out. Is there any way to do half the budget, do the important stuff first by Zoom, and hopefully meet in person for the rest?
In all fairness, we're doing what we can. The hopes were that we could all meet.
Mm-hmm.
With restrictions, we're limited to, at this point, 10. That's it. Council and the CAO and myself, we can't invite any persons to that meeting because we're at our max. So the alternate is Zoom. I don't know if there's, you know, there's discussions about maybe reducing things in other ways. I don't know. Maybe that's the discussion with the CAO and mayor.
I think we can. I think we can hold off till tomorrow. You know, I personally think we're gonna get a 28-day lockdown tomorrow.
Okay.
And I think that'll force us to meet by Zoom. But again, we'll wait and see how it goes. And we should have more information probably in the next, 7 to 10 days, and we'll know where we're going. But definitely, I would not recommend that we go past the 10th of February.
Yep.
Fair
enough.
We need to pass this budget, and we need to get, we didn't get our sidewalks done last year because we got out too late, and we need to move on this stuff. And, we're presenting a 0% budget. So I think there's still going to be some discussions and maybe some movement of money, but I think the budget is going to be a good budget anyway. So, but yeah, to your point,
Mr. Mayor, you just blew it. You just
Spoiler alert.
Sorry.
It's okay. You know what? Honestly, in accordance with the mayor, we need to get this moving forward because we need to get contracts in place if we can, because contractors are like scarce. So I agree totally. We need to move forward like we would normally. It's just how we do it. That's the discussion. So
to your point, Deputy Mayor, we'll play it by ear for the next little bit and see what we can do.
Thank you, Mr. Mayor.
Definitely an in-person meeting is always better.
Thank you.
Okay, so we are going to move in closed session. I have a motion moved by Councillor Noble, seconded by Councillor Manley. Proceed in closed session. Identifiable individual, as this matter deals with personal matters about an identifiable individual, including municipal or local board employees. They may be discussed in closed session under sections 239(2)(b) of the Ontario Municipal Act and adopt the minutes of the Municipal Council closed session meeting of December 14th. All those in favor? Motion is carried. Thank you everyone for joining us this evening. I think we got lots of great information, specifically from Dr. Paul, as we move forward through this pandemic. So thank you everyone for joining us tonight. Please stay safe and stay healthy. Have a great evening.